want you to imagine the prostate gland like a donut, and then that hole in between it as the urethra. Just squeezing that donut the way it is. And
talking about donuts right now, I am hungry. When they're having BPH, this is how is their body reacting?
Extreme urination, it causes incomplete emptying of the bladder.
Hello guys, this is Victor, your friendly RN. We are here on another edition of White Coat Chronicles. So to my right, we have Nurse Winnie. Nurse Winnie, can you tell the people who Nurse Winnie is?
Okay, hi. My name is Nurse Winnie. I am a registered nurse, a registered midwife, and I have a bachelor's of science in nursing from UNN. I'm currently doing my internship at the Nigerian Navy Hospital. Yeah.
AKA, she no book, she go school. Just put that in quotes.
Okay.
All right. So Nurse Winnie, tell us, what's the reason for this sitting today? What's the topic? What are we talking about?
Okay, we are here to talk about BPH, Benign Prostatic Hyperplasia, to talk about the BPH itself, to understand what it is, the complications, treatment, and general advice for our men.
Oh, wonderful, wonderful. So Nurse Winnie, I love the way you spelled out BPH. I'm very sure a lot of people out there might not know what it means. They just know the abbreviation of BPH. Can you tell us, explain to us in layman's terms, what exactly BPH is, like the definition of BPH?
Okay. BPH is an abnormal growth of the prostate gland in the body of the man. It leads to difficulty in urination, extreme urination, and generally pain. To break it down for better understanding, in the body of the men, we have a hormone called the testosterone. Now, this BPH is very, very common with men who are aging. So when men get old, as they get old, this hormone in the prostate gland, it gets converted to a stronger hormone, dihydrotestosterone, DHT. Now, this DHT sends signals to the prostate gland, asking it to grow, duplicate. They keep replicating. But physiologically, when there's a cell growth, there's a cell death. But when this thing is happening in the prostate gland, there's no cell death. So the cell is just growing, getting bigger, getting bulkier. And now what happens? How does the urethra get involved? In the prostate gland, the urethra runs through the prostate gland. So I want you to imagine the prostate gland like a donut, and then that hole in between it as the urethra. So now when this prostate gets bigger, it squeezes the urethra. So imagine squeezing that donut the way it is, and it makes urination extremely difficult. When they have the urgency to urinate, they go to the toilet, and when they urinate, they still feel pressed. When they are done urinating, urine is still dropping from the glans penis, and over time this could lead to infection, UTI, and the rest. So that's like
okay.
BPH.
Nurse Winnie, that was a wonderful breakdown. I love how you gave us the anatomical and physiological presentation of what BPH is, because that paints the picture to the people to understand and see it from your view. Not just seeing it from your view, but also seeing it from the view of medical personnel like yourself. And also, you talked about donuts. Talking about donuts right now, I am hungry. But let's wrap this up real quick so we can get back to the donuts. All right. After defining and explaining to us what BPH is, can we make these people understand when they're having BPH, this is what you see, this is what you feel, what is going on at the time? How is their body reacting to having BPH in it?
Okay. The first and the most significant is pain, because the prostate has gone from the original size to an extremely bigger size. So it causes pain, and then it causes weak extreme urination, it causes incomplete emptying of the bladder, it causes dribbling of urine after urination. It also causes infections like UTI, and then nocturia, because they tend to urinate a whole lot at night, making them not to sleep. So these are like the most frequently complained symptoms.
Okay. Okay. Now, the symptoms, you said you mentioned a couple classic symptoms like weak urine stream, pain, around the hour. Let's be honest. Being that this is an issue with men, when they come to your workplace, where do you work again?
I work at the Nigerian Navy Hospital.
Okay. She works at Nigerian Navy Hospital, one of the reputable hospitals around here. So, when they come to your workplace,
Yeah,
being that it's a issue with affecting the men,
yeah.
do they get shy when the female nurse attend to them? How do they respond to it?
Yeah, generally, it happens to be both genders, even girls, the women, they get shy when male doctors are to attend to them. But yeah, when they come in with such conditions, we attend to them professionally. If I am the one to attend to you, I would also take into consideration your preferences. Do you want me to attend to you? If you are not comfortable with me, would make provisions for a male doctor or a male nurse to see you at the time. But yeah, we do our best to make sure that they are not shy about anything, and we do our work very professionally. We're not there to see your private parts. We're just there to help you and make you feel better.
Okay, that's lovely. Sometimes I've experienced male patients being very open to treatments when I work with them. Maybe because I'm a male patient, I guess. But just so you know, the awkwardness is global. Just so you know,
I'm a monk. I
it's
wouldn't
very
even
global.
want a male guy need to see me, so it's
Okay,
fine.
we'll talk about that on a different day.
Yeah.
Okay, the treatments. How do you attack this BPH? What, as a medical personnel, somebody comes in with BPH, how do you, help them, take away this problem or, reduce the symptoms or depend on how the level of the BPH has gone?
Okay, so firstly, once they come in with such complaints, we catheterize so that you can at least empty the bladder and feel comfortable at the time. Then over time, I would talk about this treatment into two, the ones that they can do themselves and the ones that we will do for them. So first, we advise on lifestyle modifications. Don't drink alcohol or minimize the amount of alcohol that you take in. No cigarette smoking. Also advice on Kegel or pelvic floor exercises to help tighten the pelvic muscles. Then we also advise against sedentary lifestyle because, like I told you, BPH is very, very particular to aging men. So when they get older, they don't like going out, just want to wake up, lie down, sleep, go over the same cycle. So we advise against sedentary lifestyle. So take exercises, take walks, just be active, yeah. And then because this BPH causes nocturia, we also advise against taking a lot of water at night so that you will not have to experience wanting to urinate too often in the night. Then on our part as medical personnel, we give treatment, pharmacological treatments like alpha blockers. We also give like analgesic for the pain because it causes pain. So we give you pain reliefs. And then when these drugs are just there to help manage the symptoms, but truthfully, they cannot do the entire work. So if the BPH is not severe, we'll do like minimally invasive procedures like laser. Um, when it's like too serious, surgery. So
Okay. One other thing, adding to the treatment, I need to ask a question, just,
yeah,
for people out there.
okay.
What's your take on treating BPH with herbal medications, remedies? What's your take?
Sincerely, I am not going to. I never stand with taking herbal medications. Yes, I know that some of them are really good, like ginger for catarrh and nausea, and the rest of them. Yeah, they are good. But the disadvantages of these herbal medications is that they are not specific. They are not. They don't target a particular thing. They are like a holistic medicine, and holistic I mean is they touch everything. And because BPH is not affecting the whole body, it's affecting the prostate, how are we sure that herbs and plants you're taking is actually meant to target the prostate? So now I would always advise on taking the western or modern medicine that we give because it is very targeted, it's very specific. Before we give you any medications, we do tests, and these tests tell us the specificity and the sensitivity of your body to a particular medicine. So we narrow down the treatment to avoid you taking in toxic drugs like nephrotoxic drugs, hepatotoxic drugs, and yeah, so I would always advise in the hospital to go for Western medications because that is what we are very much aware of.
Okay. Yeah, that's lovely. I am not really a fan of herbal medications. I rather take my herbal medication from a good afan soup. I guess we're in Calabar, right?
Yeah.
I rather take my herbal medication from a very good afan soup with all the animal kingdoms in it.
Yeah, exactly.
I'm telling you, that's how I take my herbal medication. And she also mentioned something that is very, very critical. I will piggyback on that. She was talking about nephrotoxicity and about toxicity. These are two very vital organs in us that you, as an individual out there, do not want to toy with. You toy with your kidney, a lot will go on with you. Blood pressure going whack, hormones going whack. Guess what? You could go septic because urine will definitely back up. You know, that's a topic for another day. Let's not go into that right now. But when she said nephrotoxicity and hepatotoxicity, she was talking about the kidney being the kidney breaking down and the liver breaking down. So hepatotoxicity is related to the liver, and nephrotoxicity is related to the kidney. All right. So Nurse Winnie, please give us a wrap for the day. We are close to coming to an end of this section. What would you advise generally the people out there, how to go about specifically BPH?
Okay. Finally, I would say my advice is to the men. Men need to be a lot more intentional about their self, about their health, and it's very, very like they're not intentional about their health, and it's very evident in the littlest things as simple as celebration of Father's Day. You see them, they don't want to wear their outfits, they don't want to celebrate themselves, which is very different for the women because we are always standing on business. Celebrations like the day of the International Girl Child, Mother's Day, you see women, they are all out looking, sweet, celebrating themselves, even if the men want to celebrate or not. But if we shift our gaze to the healthcare, we see that more women seek healthcare more than men. And that is because from the time we're growing as young children, as young girls, our mothers will tell us, your body is open. If a man touches you, you get pregnant. These are things that we grow up with. We grow up being extremely self-conscious, and it has helped us, seek healthcare more than the men who think that they were born with some strong by default setting. But you know what? Health does not respect ego, and silence is never a treatment. Men need to be more intentional about themselves because BPH may not be cancer, but its effects are real. And when men speak up, it is often too late. And again, to the healthcare professionals, nurses, doctors, and the rest, we are the gap between these men and this knowledge that they don't know. It's our work to make them understand what BPH is and how to prevent them over time. Also, in our world today, where conditions like kidney failure, cancer kill our patients and challenge our medical front lines, conditions like BPH should not have a seat at the table of disease conditions killing our patients. So we would also have to do all we can and all we must as healthcare providers to make sure that we challenge the occurrences of conditions like BPH. Thank you.
All right, that was a comprehensive and lovely takeaway. But my takeaway from that is she shouldn't have thrown shades. But that's fine. It's okay.
Yeah.
We're trying to educate us men out there. So right now, we can take that. Anyway, it's a wrap. And thank you for hanging out with us at this White Coats Chronicles section with Nurse Winnie.
Yeah.
She mentioned all the letters behind her name, which
Registered nurse, registered midwife,
Yes.
DSC.
yes,
Yeah.
aka I go school and I no book.
Exactly.
Anyway, we'll see you guys in the next section. Thank you so much, and hopefully we get to see Winnie and all the letters behind her name again.
Yeah.
See you guys, and thank you for hanging out with us, Miss Winnie.
Thank
And we'll see
you
you
for having
again.
me.
Thank
Yeah.
you. Peace out, guys.
Bye.
Bye.